Right, so get this. We're diving deep into mood disorders today.
Yeah, these are often misunderstood.
They really are. And you might think you've got a handle on depression and mania, but stick with us because we're exploring this psychology textbook chapter. And let me tell you.
It's got some surprises.
Oh, it does. It does.
It does. It really unpacks the human experience of emotions.
It really does. So much complexity. And this chapter breaks it down when these experiences are kind of outside that normal range.
Yeah.
Let's start with this powerful image from the chapter.
Yeah.
Katie's description of depression. She says, and I quote, falling into a deep, dark hole.
Wow.
I mean, how visceral is that?
That really captures the essence of what a major depressive episode can feel like.
Yeah, it really does.
Profound sadness and losing interest in things that you used to enjoy, even physical changes.
Like that.
Like sleep disturbances or appetite shifts.
Yep.
But the crucial part here is the duration. It's not just like a bad day.
Yeah.
We're talking weeks of this intense emotional state. Yeah.
That's a long time to feel that way.
It is.
And on the other side, we've got mania.
Right.
Which is almost like living on another planet.
Yeah. Exactly.
So tell me more.
Well, mania is this intense euphoria, boundless energy. You feel like you can do anything. And sometimes people even develop grandiose plans.
Oh, like Billy in the chapter.
Yes.
And his ping-pong empire dreams.
Yes, exactly. Classic example of manic thinking.
Okay, so two poles. Depression and mania. But how do they fit into this whole spectrum of mood disorders?
Yeah.
The chapter mentions unipolar and bipolar.
It does.
And I gotta be honest, those always kind of trip me up.
Well, it's easy to get them confused. So think of unipolar as one extreme or the other.
Oh.
Either depression or mania.
Okay.
But here's the thing. You can have mania alone, but it's actually pretty rare.
Oh, really?
Yeah. So most people with a unipolar mood disorder will eventually experience depression.
So it's like being stuck at one end of the seesaw, and then bipolar is that constant up and down.
Exactly.
Gotcha.
Yeah. Those dramatic shifts, high highs of mania, and then those low lows of depression. And there are just like unipolar, different types of bipolar disorders with their own characteristics.
Yeah, the chapter breaks down those types of unipolar disorders. So like major depressive disorder,
Right.
persistent depressive disorder, also known as dysthymia, we'll get into that,
Sure.
and even double depression.
Yeah.
I mean, that sounds terrifying.
It's a really challenging form of depression because imagine you have major depressive episodes, but on top of already persistent low-grade depression.
Oh, wow.
It's a tough combination.
Yeah.
Like the case of Jack really highlights this. He battled this for over 2 decades.
2 decades?
Yeah, and it shows how chronic and debilitating this type of depression can be.
That's so sad.
It is.
It really just shows you that depression isn't just a feeling.
Right.
It can be this long-term thing.
Absolutely.
So what about grief? Is that a mood disorder or is that like a separate category?
Well, grief is a natural response to loss, but the chapter does point out that it can become more serious.
Oh, cool.
Like something called complicated grief.
So how's that different from normal grieving? I mean, we all experience loss
Yeah, we do.
in our lives.
Well, think of normal grief as waves of sadness. They come and go, varying intensity, lessen over time. But with complicating grief, the pain is really persistent. It's almost all-consuming.
Oh, wow.
And it starts to impact your ability to function.
Okay.
Like the textbook gives this example.
Yeah.
From table 6.1, years after a loss, someone might still be so overwhelmed that they can't focus. They withdraw. They can't do the things that they need to do.
So it's like grief, but to the extreme.
Yeah, it's not about judging how intensely someone grieves. It's when it reaches a level of impairment.
Gotcha.
That it becomes a clinical concern.
Okay.
And then you need professional attention.
Gotcha. So back to bipolar disorders.
Yeah.
I'm still a little fuzzy on the difference between bipolar I and bipolar II.
Yeah.
It's all about the intensity of the swings, right?
That's the main distinction.
Okay.
Bipolar I is characterized by the full-blown manic episodes.
Okay.
Like, remember Billy's ping-pong empire?
Yeah.
So bipolar II involves what's called hypomania.
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 So less intense mania.
Precisely.
Okay.
It's elevated mood, increased energy, but less severe and disruptive than full-blown mania.
Okay.
Like Jane's case is a perfect example.
Oh, yeah, Jade.
She was high-functioning during hypomania, but still experienced those shifts in mood and behavior.
So would she cycle between those hypomanic periods and bouts of like major depression?
Yes, that's the hallmark of bipolar II.
Gotcha.
And then you have cyclothymic disorder,
Okay.
which is almost like constantly being moody.
Constantly moody, so like those friends who are always up and down, never quite settled.
Yeah, it's a good way to think about it.
Okay.
It's like they're riding a constant wave, but those swings aren't as extreme as full-blown mania or major depression.
Okay, I get it.
Yeah,
So we've explored all these different types of mood disorders,
we have.
but how common are they? Is everyone equally at risk?
Unfortunately not.
Yeah.
When it comes to major depressive disorder and persistent depressive disorder,
Yeah.
the numbers are actually quite striking.
Okay.
It's twice as common in women as in men.
Wait, so mood disorders impact men and women differently?
They do, at least for those specific unipolar disorders.
Wow.
What's interesting is that bipolar disorders affect men and women equally.
Really?
Yeah.
Interesting. What about across the lifespan? Can kids experience these conditions too?
Sadly, yes.
Oh, wow.
And the chapter emphasizes how crucial early diagnosis and intervention are.
Okay.
The rates of mood disorders actually skyrocket during adolescence. Teenagers experience major depressive disorder about as often as adults do.
Wow, I had no idea it was that prevalent in teens.
Yeah.
I guess the signs might be different, though, in younger people.
You're right. In children, depression might manifest as more irritability and anger rather than sadness and withdrawal. And with mania, it might be rapid mood swings or emotional outbursts rather than those grandiose plans.
So the takeaway is that recognizing mood disorders in kids can be tricky.
It can.
It's not always straightforward.
Yeah, and it's important to remember that if these conditions are left untreated, they can have lasting consequences.
Wow.
Like the chapter mentions a study that followed adolescents who had a major depressive episode.
Okay.
Later in life, they were not only at higher risk for recurring mood disorders, but also anxiety disorders, substance abuse, even suicidal thoughts.
That's a pretty powerful argument for early intervention.
Yeah.
So let's shift gears a bit and talk about the root of these disorders. What's actually going on in the brain and the body?
Right.
It can't just be about feeling sad or feeling happy.
You're right. It's a complex interplay of biological, psychological, and social factors.
Yeah.
One of the most consistent findings is the role of genetics.
Okay.
Family and twin studies show that if you have a relative with a mood disorder, you're at an increased risk of developing one yourself.
So like genes kind of create a blueprint,
Right.
a predisposition.
Exactly. But it doesn't guarantee that you'll develop a mood disorder.
Right.
Think of genes as loading the gun.
Okay.
But the environment, things like stressful life events, actually pull the trigger.
Okay, so even if you have a genetic predisposition, you might not actually develop a mood disorder unless you experience certain triggers.
That's the current understanding.
Wow.
Yeah.
Good.
Like studies show a clear link between major life stressors and the onset of depression.
Like what kind of stressors?
Well, childhood trauma, the death of a loved one, even something like job loss,
Yeah.
these can act as triggers.
But I imagine it's not just the event itself.
Right.
It's how we interpret it and how we cope.
Absolutely. The chapter talks about how context really matters.
Yeah.
Losing a job might be devastating for one person, but a welcome change for another,
Sure.
depending on their circumstances and outlook. It's about the meaning we assign to these events, and that's where the psychological factors come in.
So our thoughts and perceptions can actually influence whether we develop a mood disorder.
Exactly, and that's where theories like Seligman's learned helplessness come in.
Oh, yeah. I remember reading about that.
Yeah.
The idea that depression can stem from feeling like you have absolutely no control over what's happening.
Exactly, and Seligman did these groundbreaking experiments with dogs.
Okay.
He showed that if dogs experience shocks repeatedly that they can't escape, eventually they just give up, they become passive even when they could avoid the shock.
So they learn to be helpless.
Right.
Is he saying that humans do the same thing?
That's the theory.
Wow.
When we face stressful situations that feel inescapable, we can develop this sense of hopelessness,
Yeah.
and that can lead to depression.
So it's like, what's the point of even trying?
Exactly.
Like Katie in the chapter with her school anxiety, she felt so overwhelmed and powerless to change her situation that it spiraled into depression.
Absolutely. A perfect example of learned helplessness.
Yeah.
And then there's Beck's theory of negative cognitive styles,
Right.
which emphasizes the role of thought patterns.
The depressive cognitive triad.
Yes.
It's a term I've always found a little daunting.
Well, it sounds complex, but it's actually quite intuitive.
Okay.
It suggests that people with depression tend to have this negative view of themselves, the world, and the future. They focus on the negative aspects, and they make these generalizations based on very limited evidence.
So almost like a self-fulfilling prophecy of negativity.
Yes.
Our thoughts become so distorted that they actually contribute to that depressed state.
That's a great way to put it.
Wow.
And this is why cognitive therapies can be so effective,
Right.
because they focus on challenging and reframing those thoughts.
So we've got genes setting the stage,
Mm-hmm.
stressful life events acting as those triggers,
Right.
and then our own thought patterns kind of amplifying those feelings.
Yeah.
But I know there's another piece to this puzzle, right?
There is.
The social and cultural context.
You got it. We can't underestimate the impact of our relationships, our support systems, and even societal norms on how we experience and cope with mood disorders.
Yeah, the chapter mentions a link between marital problems and depression, especially for men.
It does.
And that surprised me.
It is counterintuitive.
It is.
But studies show that marital problems are a common trigger for both men and women. But men are at a significantly higher risk of developing depression for the first time if they experience a separation or divorce.
Why is that?
Well, one thought is that men tend to rely more heavily on their spouses for emotional support and connection.
Ah, okay.
So when that relationship is disrupted, it can have a huge impact.
Yeah.
Women, on the other hand, often have broader social networks, more diverse sources of support.
Gotcha. And that can provide some protection.
It can.
And speaking of gender differences,
Yeah.
we can't ignore the fact that women are twice as likely to experience major depressive disorder and persistent depressive disorder.
Right. And it's not just a Western phenomenon.
Really?
It's consistent across cultures.
So what's going on there? Hormones? Social pressures?
Probably a combination.
Right.
Some research suggests that hormonal fluctuations play a role,
Okay.
particularly during things like menstruation, menopause.
Yeah.
But you also can't discount social and cultural factors.
Right.
Women are more likely to experience poverty, discrimination, sexual harassment,
Yeah.
all of which can contribute to stress and hopelessness.
So it's like all these factors, biological, psychological, and social, kind of converge
Yeah,
to create this perfect storm for depression in women.
they do.
That's really eye-opening to see how connected these elements are.
It is, and it highlights the importance of a holistic approach to understanding and treating mood disorders. There's no one-size-fits-all explanation or solution, but by appreciating these different dimensions, biological, psychological, social triggers, and how everyone experiences these conditions uniquely,
Sure.
we can start to see the full picture.
This has been a fascinating deep dive into mood disorders.
It has.
We've explored the spectrum,
Yes.
the causes,
Yeah.
even societal and cultural influences.
Absolutely.
But we've only scratched the surface.
We have, in the next part, we'll shift our focus to treatment options.
Okay, great.
Medication, therapy, lifestyle changes, different approaches.
Perfect.
We'll delve into what works, what doesn't, and the research that's expanding our understanding.
Awesome. And I'm glad we saved this last part for the next part.
Yeah.
We can't shy away from this conversation about suicide.
Right.
So we're going to explore the link to mood disorders, the risk factors, the warning signs, and what we can all do to prevent this tragic outcome.
Exactly.
So stay tuned for a deep dive into the world of treatment and prevention in part 2.
Yeah.
We'll see you then.
See you then?
Welcome back. You ready to get into treatment options for mood disorders?
Absolutely. And the good news is that there is hope.
That's what we like to hear.
We've come a long way in understanding and treating these conditions. And while there's no one magic cure-all, there's a range of effective options out there,
Okay, good.
from medication to therapy and even beyond.
I'm particularly interested in the medication aspect,
Yeah.
especially antidepressants.
Mm-hmm.
Are SSRIs still like the go-to choice, or are there new approaches on the horizon?
SSRIs, things like Prozac and Zoloft, are still very widely prescribed.
Okay.
And for good reason, they've been proven effective for a lot of people.
Right.
Think of SSRIs as like rebalancing a seesaw in your brain that's tipped towards sadness.
Okay.
They work by increasing levels of serotonin,
Okay.
which is a neurotransmitter that plays a key role in mood regulation.
So they're not just like boosting happiness, but like helping restore balance in the brain's chemistry.
Exactly, but they're not a magic bullet.
Right.
Studies suggest that SSRIs are effective in relieving symptoms for about half the people who take them, but only a quarter to a third achieve full remission.
So medication isn't a guaranteed solution.
Right.
What happens when SSRIs don't work?
Well, there are other options.
Okay.
Sometimes adding a second medication can help, like a mood stabilizer.
Mood stabilizers, what are those typically used for?
primarily for bipolar disorder.
Okay.
They help prevent the extreme highs and lows that characterize that condition.
Right, right.
Lithium is a classic example, but newer options like anticonvulsants are gaining traction as well.
Anticonvulsants, those are for seizures, right?
Mm.
How can they help with mood stabilization?
It might seem surprising, but it really highlights how interconnected the brain is.
Yeah.
Anticonvulsants were initially developed for epilepsy, but they were found to have mood-stabilizing effects.
So a medication designed for one condition can be effective for another.
Sometimes, yes.
Wow, that's fascinating.
It is.
But what about side effects?
Yeah.
Are mood stabilizers as challenging to manage as some of those older antidepressants?
Well, all medications carry potential side effects, but mood stabilizers generally don't have the same intensity as some of the older antidepressants like tricyclics.
Okay.
It's always important to weigh those risks and benefits with your doctor, though.
That's a good point, but medication isn't the only option, right?
No, not at all.
The chapter really emphasizes psychotherapy
It does.
as a key component.
Yeah, actually, a combination of medication and psychotherapy is often the most effective approach for treating mood disorders.
Interesting.
It is.
So what are some of the most common types of therapy used?
One of the best known and most well-researched is cognitive therapy, developed by Aaron Beck.
Oh, yeah.
Remember that depressive cognitive triad we were talking about?
Right, those negative views of oneself, the world, and the future.
Exactly.
Yeah.
Cognitive therapy targets those very thought patterns.
Okay.
It helps people identify, challenge, and replace them with more balanced perspectives.
So like retraining your brain to think more realistically.
Exactly, breaking free from those negative spirals. And research shows it's effective for both acute episodes and preventing relapse.
That's great.
Yeah.
What other types of therapy are out there?
Another powerful one is interpersonal therapy, or IPT,
Okay.
and that focuses on the social and relational aspects of depression.
Oh, so like addressing those relationship challenges we talked about.
Yes, exactly.
Like how marital problems can increase that risk, especially for men.
Exactly. IPT helps people identify and address those issues that might be fueling their depression.
Okay.
Might involve things like improving communication skills, setting healthier boundaries, resolving conflicts.
It's all about strengthening your support system
Right.
and building those more fulfilling connections.
It is, and that can have a ripple effect on your overall well-being.
Yeah.
It's not just your mood.
Not just your mood, right?
There are also newer approaches, things like mindfulness-based therapy.
Oh, mindfulness is like having a moment right now, I feel like.
It is in the wellness world.
It really is.
How does that apply to mood disorders? Well, the chapter specifically mentions mindfulness-based cognitive therapy, or MBCT,
Okay, MBCT.
which combines mindfulness techniques with traditional cognitive therapy.
Okay, and what's the focus there?
It's about developing a heightened awareness of your thoughts and feelings in the present moment without judgment.
Okay.
So instead of getting swept away by those negative thoughts, you learn to just observe them with a sense of detachment.
So like becoming an observer of your own mind rather than being controlled by it.
Exactly. You cultivate a sense of acceptance and non-reactivity to your inner experience,
Wow.
which can be incredibly powerful for managing mood swings.
So we got medication, cognitive therapy, interpersonal therapy, mindfulness.
Right.
It seems like a lot of options,
There are.
which is great.
The best approach really depends on the individual, the severity of their condition, and their personal preferences.
Right, there's no one size fits all.
Exactly.
But it's not just about addressing the symptoms in the moment, right?
No.
There's the long game of preventing relapse.
Yep. You're hitting on a really important point. Once someone has achieved remission from a mood disorder,
Yeah.
it's crucial to have strategies in place to stay well. That's where maintenance treatment comes in.
So what does maintenance treatment look like?
It can involve continuing medication, ongoing therapy, or a combination.
Okay.
But the goal is really to provide continued support and equip people with the tools to manage their condition long term.
So like a plan to safeguard your mental health
Exact.
and navigate those ups and downs in life.
Right, because recovery is not a destination, it's a journey.
That's true, and having that support can make all the difference.
It really can.
I want to address a difficult topic,
Yeah.
but I think it's crucial to talk about
It is.
suicide.
Mm-hmm.
The chapter mentions it as this tragic outcome linked to mood disorders.
It is a heartbreaking reality, unfortunately.
Yeah.
Suicide is the 11th leading cause of death in the United States,
Wow.
and the third leading cause among adolescents.
That's alarming. And I imagine the actual numbers might be even higher
You're probably right.
because of the stigma.
Yeah, a lot of suicides go unreported or they're misclassified.
So it's like a silent epidemic.
It is, in a way.
What do we know about the causes? Is it always tied to mental illness?
While not every suicide is linked to mental illness,
Okay.
it's definitely a major risk factor.
Mm.
The majority of people who die by suicide do have an underlying mental health condition.
And most commonly a mood disorder.
Most commonly a mood disorder, yes.
It's not just mental illness, right?
Right. Other factors can contribute.
Yeah.
Things like life stressors, relationship problems, financial troubles, job loss. These can push someone to a breaking point.
Yeah.
And sometimes it's a combination of factors that creates this perfect storm of despair.
So what are some of the warning signs
Yeah.
that someone might be at risk for suicide?
There are several red flags.
Okay.
Things like talking about wanting to die, feeling hopeless, withdrawing from loved ones, giving away possessions, making sudden changes in behavior.
Okay, so it's not just what people say,
Right.
but how they're acting.
Exactly.
Yeah.
And it's important to remember that suicide is often impulsive. Someone might not have a long-standing plan, but they might just reach a point of desperation and see no other way out.
That's scary.
It is.
So what can we do to prevent suicide? It feels overwhelming.
The most important thing is to talk about it.
Okay.
Don't be afraid to ask someone directly if they're having thoughts of suicide.
Okay.
Contrary to what some people believe, talking about it does not increase the risk.
Okay.
It can actually be a lifeline.
So it's better to be direct and ask even if it feels uncomfortable.
It is.
Okay.
Expressing your concern and offering support can make a world of difference.
So if someone does express those thoughts, we need to take them seriously
You have to, yes.
and get them help.
Absolutely. Professional help immediately.
Don't try to handle it alone.
No.
Reach out to resources, suicide hotlines, crisis intervention centers.
Exactly. And there are specific therapies that target suicidal behavior,
So,
like cognitive behavioral therapy or
Mhm.
dialectical behavior therapy. Those are designed to help people manage those impulsive and self-destructive behaviors.
so there are interventions, there's support.
Yes.
It's not a hopeless situation.
Not at all. It requires this multifaceted approach that addresses both individual and societal factors.
This has been really informative.
What?
Looking at treatment and prevention, we've covered a lot of approaches.
We have?
Medication, therapy, lifestyle changes,
Yeah,
and really emphasizing personalized care
absolutely.
and that ongoing support.
It's key.
And I'm glad we touched on this sensitive topic of suicide.
Yeah.
It's so important to have open communication,
It is.
early intervention, recognize those warning signs.
Absolutely.
But our exploration of mood disorders isn't over just yet.
Not quite.
In our final segment, we're going to take a look at how culture shapes our understanding and experience of these conditions.
Right.
So stay tuned for a journey into the cultural nuances of mental health in Part 3. And we're back for our final segment on mood disorders,
We've covered a lot, from defining depression and mania.
to exploring those causes, the treatments, and even that sensitive topic of suicide.
Right.
And as promised, we've got this fascinating dimension to discuss, how culture shapes our understanding of mood disorders.
It's a crucial part because mental health isn't a one-size-fits-all experience.
Not at all. And what's normal in terms of emotional expression can vary so much across cultures.
It really can.
So how does culture actually influence our understanding of these conditions?
Well, for starters, different cultures have different ways of talking about and expressing emotions.
Right, some cultures are more open, others are more reserved.
Exactly. And those norms can really impact how people experience and communicate their distress.
So someone from a culture that really values stoicism might be less likely to openly share their feelings of sadness or hopelessness.
That's a possibility, and that can make it harder to recognize and diagnose mood disorders.
Yeah, because they might be suffering in silence, right?
Right. Their internal experience might not match their outward expression at all.
And they might not even have the language to describe what they're going through.
Right. Or they might fear being stigmatized for speaking up.
It's like culture shapes the whole experience of mental illness.
It really does. And it's not just about emotional expression. It's about how different cultures conceptualize mental illness itself.
Right, the chapter mentioned that in some cultures, mental illness is seen as like a spiritual or moral failing,
Exactly.
rather than a medical condition.
Exactly. And that can have a huge impact on whether someone seeks help and what kind of support they get.
Yeah, if you believe your depression is caused by a curse, you're probably not going to run to a therapist.
You're less likely to. You might turn to a religious leader or a traditional healer instead.
And those approaches, they're not always as effective for a clinical mood disorder, right?
It depends. Sometimes those traditional practices can be helpful,
Okay.
especially if they provide a sense of community and support. But in other cases, they might delay or prevent someone from accessing treatments that could really make a difference.
So it's finding that balance, respecting cultural beliefs, and making sure people get the right help.
Absolutely, and it requires sensitivity from mental health professionals.
Yeah, we can't just impose our Western medical model on everyone.
Right, we have to consider their background.
The chapter also mentions somatization.
Yes.
Can you explain what that is?
It's the tendency to experience and communicate psychological distress through physical symptoms.
So instead of saying, I feel anxious, someone might say, I have a terrible headache.
Exactly, and it's more common in some cultures than others, especially in Asian, African, and Latin American countries.
Why is that?
There are a few theories.
Okay.
One is that there's a bigger stigma around mental illness in some cultures.
So expressing emotional distress is seen as a weakness.
Right, something to be ashamed of.
Okay.
And that can lead people to kind of channel that pain into physical symptoms.
Which are more acceptable to talk about. So it's like their body is speaking for them.
That's a great way to put it.
Yeah.
And it can make it tough for healthcare providers to diagnose and treat the actual mood disorder.
Because they might focus on treating the headache
Exactly.
and not the root cause.
Right. It highlights the need for what we call cultural competency in healthcare.
Right.
Providers need to be aware of these differences in how symptoms present.
So they ask the right questions.
Yeah, to really understand what's going on.
This has been really eye-opening.
It has.
It shows how mood disorders aren't just about brain chemistry or psychology.
Right?
They're tied to our culture.
Absolutely. Mental health is so multifaceted, influenced by all sorts of things, including our cultural background.
And understanding those nuances is key for providing the right care.
Absolutely. So as we wrap up this deep dive on mood disorders, I hope you leave with a better understanding of how complex they really are.
We've learned they're not just about feeling sad or happy.
Right.
They're rooted in our biology, our psychology, even our social and cultural contexts.
And the good news is that they are treatable. There's hope.
There is.
If anything we talked about resonates with you, please reach out to a mental health professional.
Yeah, there's no shame in getting help.
Not at all. It could make a real difference.
This deep dive has given you a great foundation, but keep exploring, stay curious, and take care of yourself.